Hafa Day and Biba Mes tomorrow. We always celebrate Mes tomorrow on this show, and we have a wonderful physician, as someone who has dedicated her practice, her life to the study and care of the eyes, and a proud island Tamarita, and someone who I know, Dr. Marlene and Nicolas at FHP Vision Center. Biba Mes tomorrow and Hafa Day to you and your family and your team.
Yes, Biba, Mr. Morrow. Hi,
Absolutely.
Jason.
Very, very good to see you again. I remember how much fun we had during our last interview. So we had to bring you back because, you know, like I said, you practice good sound science and good medicine, giving, reliable, proven advice. But then you've also got that, chamarita toughness. It's like, hey, take care of yourself.
Yeah, we always have to have that message. It's like, we're all fun. I like to have fun in my exams, but let's get down to the nitty gritty.
Exactly. And as such, we're going to talk today about a acronym which I have never heard when it comes to the care of the eyes, CLARE, C-L-A-R-E. Would you be so kind as to break that down for me?
Okay, CLARE is, CL is contact lens induced, A-R-E is acute red eyes. So everyone is familiar with red eyes. Mm. So this one is a red eye that's comes from the contact lenses. People like to wear contact lenses, but this is the problem that we can get with contact lenses. So we're trying to get the message out there about what this is.
Is this caused, Doc, primarily because of a misapplication? Like they put it in wrong, or they force it, or they don't clean, or use the saline solution enough, or a variety of things?
Actually, the acute red eye is actually due to overwear of the contact lenses.
Ah, okay.
Yeah, and then a lot of patients like to take their chances and sleep in lenses, tend to keep their contact lenses longer than they should. A lot of them do not like to clean them. They just keep wearing it until their eyes turn pink.
Okay, and then what medically, and I guess in terms of symptoms, can result and ensue from people wearing contact longer than they should?
When they wake up with what we call acute, meaning they went to sleep the night before, their eyes were fine, and they wake up in the morning, their eyes are, they're red, they're puffy, they're crying, and it hurts when the lights hit it, and then some of them
crusty,
are like,
maybe they got the morning glory thing, they got the mugu in their eyes.
The thing about the contact lens related is that it's really not crusty. It's mostly painful and lots of crying. And it just happened the night that you wore your contact lenses or overwear them. Now, the solution to that one is just take them off. Don't wear them for a while and see if it gets better. The problem with it is that some patients ignore it, and then it ensues and it gets worse and worse and worse. And by the time they get into my chair, it's not a simple contact lens related issue. It escalated to a more of an infection. So, yeah. So when we talk about, the contact lens related red eye, it means it just happened. And so if you do,
so minor irritation of the eye.
Sometimes it's not so minor, because some of them, when I question them, so it's always on case history when I find out that it's contact lens induced, meaning you didn't listen when you woke up and your eye was pink, you decided to wear your contact lenses, and it kept on happening, and then finally they woke up and now they can't put the contact lens on. So they,
and even though you're an eye doctor, Doc, this is when you get Dr. Nicolas as you pinch the ears and you say, "Toke, see, I told you already."
Well, most of the patients that I've seen, they usually come back when it happens again, and they said, this happened again. She goes, "Yeah, I know, Doc, I know. Can't you just give me my medicine?" And I'm, no, wait a minute, no, we need to go a little further than this, because it shouldn't be repeated.
Now, when it comes to, I'm sorry, please.
Yeah, when it's repeated, that's already that's a bad thing.
Now, when it comes to the treatment, how is it very easy to not differentiate between this condition, CLARE, acute red eye, from overwearing contact lenses, and say something that we're probably more familiar with, like conjunctivitis or pink eye?
Right. See, that's just it. You don't know. So when they come in, I have to do the case history. The case history tells me, okay, we're dealing with a contact lens issue. But on further investigation, it's like, oh, it's not a simple contact lens issue. It could be an ulcer. It could be an inflammation that's further than that. It could also be viral. It could also be allergic.
Mm,
So, so you don't mess
any
with,
number of things.
yeah, so you don't mess with pink eyes. So my advice to patients who wear contact lenses is you wake up in the morning, you have a pink eye, don't wear your contact lenses.
Mhm. Okay,
Let
and then
your eyes breathe.
final question, Doc, because I know when it comes to contacts, I grew up from the generation that the only people that ever wore contacts were people that had prescription contacts, because it helps them see better. And obviously, you're an expert in that. But the kids these days, they wear the colored contacts because a lot of people wear them purely for aesthetic purposes and everything. Is there any difference in people wearing those longer, or does it matter?
It does not matter.
Mm,
Contact lenses is contact lenses. Think of it as it is foreign. It doesn't go in the eye. It's not natural to the eye.
mhm.
You have to make your eyes get used to the contact lenses. So, not knowing all these things, patients will go get contact lenses, or sometimes they get it from a friend who says, oh, I have these colored lenses. They don't have prescription. You want to try them? And I'm like, don't do it. Go talk to your eye doctor. Make sure your eye is healthy enough to wear contact lenses first. And if you do wear them, please, if you have a red eye, take them off. If it recovers, great. You did the first line, first treatments to take them
Mhm.
off.
If God wanted you to have blue eyes, he would have given you blue eyes.
Exactly. I, I look at them and I said, what were you thinking? And then, I've actually seen some really bad eyes where what was supposed to be just acute and could have been taken care of has gone all the way to ulceration. And
Mm,
having an ulcer in the eye, just hearing the word ulcer,
yeah.
yeah, it's not fun. I've seen people lose their eyes to an ulcer.
Oh my gosh.
Yes, because they waited too long to come
Okay.
in, get treatment. And by the time we get the infection under control, um, it's scarred up. It's a scar.
So
And
again, Doc, this is why we love having you on this segment on Hafa Health, because you don't mince words, you don't pull punches. So I got to let you go with this statement. So now that we know that you should be changing your contacts and not wear them for exorbitant amounts of time, what is the optimum cycle that people should be wearing their contacts for without overdoing it?
well, my advice for patients who wear contact lenses is number one, do not wear your contact lenses at home. If you're going to stay home, please wear your glasses, give your eyes the oxygen time it needs. And if you have a pink eye that doesn't go away, please see an eye doctor, to make sure that it is something that will go away on its own or it does not need treatment.
That's easy enough, and that doctor's orders.
Yeah. Yeah, and get your annual eye exam. That is
There you-
the number one thing I can ever tell anyone who wears contact lenses is make sure you get an eye exam to make sure that the lens is fitting right and that your eye is healthy enough to continue wearing contact lenses.
All right. Well, Dr. Marlene and Nicolas at FHP Vision Center, we thank you for your expertise and your time. You know what? We're going to end this segment now, guys, but I'm going to make some time with you, Doc, because I got to get my eyes checked. So I'm going to come see you real soon.
Okay, Jason.
All right. Thank you very much, Susan Mossy.
Yeah, take care.
All right. Bye-bye.
Bye.